morning, bon dia. I really feel so grateful to be invited to this conference, and I really think that it's really important to note about this topic because we are living now a new worldwide situation that doesn't just affect our physical health. Really is affecting our mind, our soul, our spirit. It's important, don't forget it. And like healthcare professionals, try to have always in mind that we are living now a new normality that can change our lifestyle for a long time. We need to understand that we need to learn more about COVID. That's true, but not just about signs and symptoms, diagnosis, prevention, management, and physical outcome. We need to have in mind all the feelings, all the emotions, that we need to have balance and stronger to pass this time without lost hope. Family is one of the big supports in the challenge to overcome this pandemic. I want to dedicate this conference to my colleague and friend, Ernesto Rodriguez Sanchez, pediatrician and neonatologist from Colombia, during a long time before I worked with him, that is now a new angel on heaven, another superhero that leaves us for this pandemic. This is for you, Ernesto. What's happening in the world? Unfortunately, we are living now with a scare, we are living now with fear, because really we are not knowing a lot of things about COVID. Unfortunately, we are really associate COVID with death. The just true that we really know about COVID is that each infected person can transmit the virus to between 1.4 and 2.5 people from before the symptoms appears. Is one of the truths. But every day, every moment, all the information is changing. And now the only truth is that all can be true. What happens in the NICU, in the neonatal intensive care? At the beginning of the pandemic, we were really thinking that kids don't have severe compromise, that there is some vertical transmission, that kids are only carriers and they don't suffer disease, and neonates don't have complications. Kids don't have risk. But now, in the time, we are learning that there are cases of vertical transmission that, depending on the gestational age and the risk factors, can be real complicated, and we don't know exactly what is happening with neonates and COVID in this moment. And really, there isn't enough evidence to say that it's not dangerous for our babies. In Netherlands, at the beginning of the pandemic, the kids don't have severe compromise, there isn't vertical transmission, kids are only carriers, they don't suffer disease, neonates don't have complications, kids don't have risk. We are preventing horizontal transmission, and the more important question is, are you able to take risks if you don't really know what is happening? And there is not really evidence of the severity of clinical cause for disease. That is really the truth. Every day, all the things are changing. In Colombia, that now, unfortunately, my country, my natal country, is one of the countries that is really suffering a lot of COVID in this moment. At the beginning, the AO started with the restriction of the visit, one parent by day by visit, free phone calls by video all the time. They are offer open information for the 24 hours for the patients. The COVID suspicious or positive babies, they have like a special isolation box. The parents COVID positive cannot come. And improving the communication challenge in the pandemic crisis. That is really the challenge now. But now with the increasing of the cases, so we are really showing in these pictures that at the beginning they were coming in contact with these babies, using the mask in the moment of the contact with the baby at the first time. But now in Colombia, we are living in quarantine, really that is the big challenge. And now they are increasing the protection for the healthcare professionals and the protection for the parents, but always respecting the contact between parents and baby. That is really important. And here I want to show you one scenario in one of the clinics of Colombia. This is a normal delivery, and we are looking the gynecologist, the nurse, the anesthesiologist, and the father with all the protection to be in contact with the baby. This is a mom COVID positive. Depending on the mom, she will have contact or not with the baby. What's happening is Curacao. Curacao, our beautiful island, is really a nice place, a nice island with a lot of nice people that is really always with a smile for all the patients that are coming to our NICU. Now we are with the normal novo, with the new normality. Now we are respecting all the new measures to try to prevent the transmission of the COVID. And really we are living this new normality, and every change, every challenge is happening every day. In this moment, we are with prevention policies. Now we have local new cases. We are in phase 3, and every day, really, we are increasing the number in case. In this moment, we are with 26 cases, positive cases. And by this pandemic, we are increasing and opening the NICU to all the Caribbean. So in this moment, we are really the referral center for all the Caribbean. And obviously, we are with the fear if we will have or not a lockdown again. This is our NICU. We are the referral center for the Caribbean. We are receiving our local population and all the Caribbean referral patients. We are not denying any patient. All mom that with a high-risk pregnancy, all newborn baby that need to be referred to here is received always. And we treat premature babies with all the complications. The idea is, what should you do? Obviously, the more easy is to say stay home, but obviously in the NICU we cannot stay home because our home is the NICU, and for the babies the NICU is the first home before to go with parents at home. What is our idea? Protect you and protect me, but always with love and good care. And now we need to be and live our reality, the normal novo. Our NICU, we are trying to maintain a social distance, a space in every chamber between beds, safety for babies, parents, and health workers. That is really easy because it's the physical part, it's all the structure. But like I told you at the beginning, we cannot forget the feelings. For the safety of you and your baby, this is our turtle, our new turtle that we adopt for this new quarantine and this new lockdown and the pandemic situation. And we are trying to make one visit morning in per beds, one visit afternoon per beds, 3 hours, one of 2 parents by baby, and always the hand washing and of the protection measures. What do you want to do? Because one thing is that you must to do, and what do you want to do? Like healthcare professionals, obviously, we want really to defend our patients about the coronavirus, and we really want to be protected. But really with the coronavirus, we are learning that it's really like David and Goliath. David is really the coronavirus, and we are Goliath. But the idea and the challenge is try to change that. Obviously, like healthcare professionals, like doctors, like nurses, we want to treat the disease, and we want to save all our patients. We want to improve the quality of life, minimizing the risk for loss. But we need to have in mind that in the NICU, we have patients that by the simple fact that be newborns, they are with immunodeficiency, they are immature, they can have unknown risk factors, they can have unknown susceptibility and severity, and a lot of variations every day COVID about. For example, in the last update of the British Medical Journal in May of 2020, one now of the risk factor including is be and have below 1 month of life. Like that and mom, what is happening with parents with the COVID situation? Obviously, they want to defend their babies about the COVID situation. But the idea and the more important thing when we are trying to explain to the parents about the time restrictions is when you want, you have time. If you don't, you have excuses. And really for the parents, it's not the quantity of time, it's the quality of time that we need to give them. Improve the quality of time, minimizing risk of lose quality of life. That is really important. If you are sick, you don't want to make your baby sick. You don't know really what will happen if you make sick your baby, because that is the truth. Can be happen nothing, or can be happen a lot of bad things. But if you know that with right duration, right information, and in right moment you will be with your baby, that moment will be enough to be strong and understand that you protect your baby. That's true love. But for that, we need to be the channel for the parents to do it. Like a baby. What's going the baby? We can't believe what is happening but the baby. Obviously, The baby is in front of the coronavirus. And the more important in that moment is I want to live, because he is in the beginning. He is the miracle of life for all that parents that have the babies in the Unity intensive care. The baby obviously wants to stabilize and be in safety environment that protects me of all the risk. NICU is my protection. They are safety wards, taking care of me to stay with you healthy and strength to live together in happiness after this. And this is the idea, and this is the future that we want for our babies. I need to improve, and I need my parents, but I cannot take risks. That is really important to know. I need to improve, and parents' love is the best medicine. For that, I need to work with the contact, a special time, special protection clothes, special measures. I need to stimulate the parents to talk, the voice, the special moment to talk and sing with the babies. Mother milk, don't lose every drop of golden that you give me to grow. Is the real act of love. If we can do it, we need to do it. Can I do it? That is the new question that we have now. Sometimes in life, we just need a hug. No words, not advice, just a hug to make you feel you matter. Really, in this moment, a hug? We cannot forget that we are in the new normality, and unfortunately, we cannot hug. And for that, it's really important for the parents that we really can explain what is really happening. Social distance of my baby for your baby's safety. And I am really proud to show you one of our small babies of 25 weekers that is really one of the more beautiful babies. Obviously, this picture is with authorization of mom. Protection of my baby is to protect my baby, really. That is the important thing. Isolation of my baby is the isolation from danger. And I want to show you with this picture when we have our babies in quarantine, if you are really looking, since the hall really looks sad, because you are looking like in the deep of the hall, the baby with all the protection and the nurse, but the idea is that the parents can come inside and can have contact with the baby, with all the miserable protections, but they can stay there. Separation of my baby. Like Stitch is telling me, you abandoned me? Is really the more important part. It's physical, but never emotional. Obviously, we will find sadness, but that sadness will be happiness after, because your baby will be with you forever. Depression, obviously, and we need to detect, because we can suffer depression, but the parents and the families too. We need to stay strong. It's part of this situation. And it's our responsibility to identify and always help, not always with the families, with our colleagues, with our friends. What I am going to do, because we need to do something. We need to adapt, and we need to stabilize any challenge to erase this. Obviously, we are in the line of fire against the coronavirus, but I cannot take your hand, but I can stay with you and show you. You are not alone. How can I give big quality in place of quantity? How can I stay if I cannot stay? Quality of time, if I have 3 hours by day, but they know they will be in contact with the patient, touching the patient, and we are trying to maintain the social distance and improve the things for the baby, I really think that we are optimizing the care, but we are improving the training of the parents and the feelings. We are preventing the depression. And obviously, we need to explain. We need to ask always, and we need to answer. Why, how long, when, what. If we explain, I really think that the parents can understand. Ask. We need to ask too. How do you feel? Do you understand me? Why is this? Can I help you? Can I support you? Listen. Not hear. Listen. Always we need to have time. Never say don't. Never minimize feelings and emotions. And always give options, no questions, because we are really the direction. You can come at this time. It's better that say you cannot come. You need to take care of, because always give the explanation. You cannot stay here all these times, but I can offer you that you come at this time. Always you can ask me, tell me, and find me for you. This is for all the healthcare professionals. Quality of time. How can I have all the time if I don't have time? explain, time to come, things to do, procedure, reasons, and how to improve that quality of time. And ask, how do you feel? What do you think? Do you want to do something more? Give options, no questions, always. You can come at these times you need to take care of because you cannot stay here all the time, but I can offer you. Always you can ask me, tell me, and find me for you. Quality of time is important. How can I touch if I cannot touch? Explain how to do it, when to do it, and why cannot now. So it's don't say you cannot touch, it's you cannot touch now, but after you can do it. Ask, is clear for you? Is important for you? Do you understand why? And always give options, no questions. You can touch after, you can touch with, you can touch now, and never say no. Love, support, attention, understanding, therapy are not numerical measures. I cannot give you all my time, but I promise you, the moment you are with me, I will give you so much that you will fill all the empty space. Thank you very much.